Last but not least, we'd like to invite Dr. Arnaud Menach, who is the Director of Malaria Analytics, Surveillance and Technology at the Clinton Health Access Initiative.
Good afternoon, everyone. And thank you for the invitation to talk during that symposium. So I will be talking mainly on how modeling was used to inform decision-making, mainly like from the side of the planning and for the side of the resource mobilization. Just a bit of a reminder that I think everyone in the audience know about, but there's been a plateaued in terms of the amount available funding globally on malaria, which is like around like 2.5 to 3.5 billion every year over the last decade. And that's actually like below the GTS investment goals of about like 4 to 4.5 billion in 2016 and 2017. So, I mean, the idea, like thinking about that like plateau in funding is that, I mean, those funding constraints always like outline like the need to be a bit like more effective in terms of like targeting of existing resources. And that's obviously not only like a money reason when you think about it, because at the end of the day, it's also like a really like technical reason. So if you look at those like two maps and what they represent, the top map being about like predicted malaria prevalence above 1%, and the map in the bottom, it's about like predicted net coverage. And what you can see, depending on the region, is that sometimes it aligns quite well. So if you look in the southwest region, there is like a higher malaria risk and bed net being distributed. But in some other places, you will find like the situation where there is like very low risk of malaria and still like bed net being distributed because it's more accessible, and vice versa. You would have like places like in the north where there is like risk of malaria and very low like bed net coverage. So from a technical perspective, it does make sense to be like thinking about where you want like to target your resources under those like funding constraints. The other piece as well like to think about is just trying like to do like everything everywhere, like come with a cost, and there is like really like an operational cost at increasing coverage. So when you think about increasing access, for example, here to ITN at the household level, I mean, going from like 40 to 50% coverage means distributing about 126 million nets globally. If you then want like to increase from 80 to 90, like the cost in terms of bed net is like 4 times that number. So achieving like higher coverage does come with an operational cost, which is quite high. And actually, I mean, in fact, and we're here actually to talk about like modeling. So thinking about the importance of like modeling is that model can help really like target those resources. And I think Bea before has done like a very good job at explaining like the framework to how like model can help targeting an NSP. And then the output actually of like the technical output of the model can then be costed and inform those operational plan. So when you think about resource mobilization, is that at the end of the day, you kind of like want a cost figure, I would say. So that's with the global fund like an optimized funding request. But to get there are like different like steps and stages. Bea really like talked about it, so I'm not gonna like talk too much in detail about it. But it's first like thinking about like the program review, what worked in the past, what didn't work. Then based on those like lessons learned, is that how that can inform your strategy like development, what you want to do a bit where. And that like those strategies sometimes which are a little bit like broad can be like translated then into more like specific operational planning. So when we talk about like distributing LLIN, exactly like where, when, to whom. And there are like often indeed like discussion around optimization and prioritization of activities, because in a real world we just like can't do everything everywhere. And so like where does like modeling fit with all this? I mean, I would say like everywhere. Where like model can really help like those like different steps of the planning to come up with a funding number. So indeed, like modeling can help at the program review stage with assessing the impact of intervention at the strategy level, it's about like knowing like what to do where, and I think the previous like presentation, both in Tanzania and Zambia, gave a very good example of this. And then eventually you arrive with like strategy, and then modeling can help like refine, develop a little bit more like the operational requirement of that strategy, and help like allocate resources based on those different like technical, operational, or financial constraints. And then when you look a little bit at the history of like modeling, I mean, there have been like a lot of like models being developed, even more over the last like 15 years, mainly for malaria, also like quite a lot for dengue. Has it been used in country? I mean, it's hard like to know. I think for a long time, like very few actually have been used. They were like mainly for, I would say, like academic like purposes, refining like the methods. And then I think what we've been observing over the last like, couple of years is how you bring like those models closer like to the program. And again, the two previous talks gave a very good example of this. To do that, really, I mean, an effective like modeling in country will rely on this important like interactive interaction with the program. So there are different like stages of like modeling. There's first like a technical iteration. So it's like thinking about basically what are the questions, collecting the data, being able like to decide on the parameters. Then as well, like the next step is really like thinking about what are like the scenario you want like to simulate, and being able like to simulate those. Once that has been done, well, that informs like your planning, and that can inform also like your operational and your like operation. You can like cost that plan, and then you will implement it. Once implementing, again, you like close the loop basically because you want to know whether your intervention have like worked properly or not. From that like technical iteration, I just like really want like to outline like one of the key steps, which is like true for modeling as true like for any science, I would say. It's really like thinking about like what are the questions. You can have like different type of model depending on your question. So if your question ends up being like optimizing resources, what you really want to know is like, how do I reduce my case number given my limited budget, for example? But the question might be different. You might have like another question, which is more like for fundraising, for example. And here in that case, you would want to know like, well, actually, how much would it cost to go to elimination in a specific places? So just like putting a little bit of emphasis about defining that question. And I mean, it's not only like a technical iteration. For each of those steps, you actually have like programmatic iteration. So between the malaria program or like the program like you work for and like the modeler. I think Emily yesterday did a very nice presentation about like the importance of that interaction and how that interaction, it's not a one-off. You will discuss like the source of data, and then you would discuss the scenario, and then you would test the scenario, and then you would like come back to refine your analysis. And I think each of these steps of the technical iteration translate as well into like some kind of like programmatic iteration. So that's a bit like I would say like a general framework, but how was that applied? So TRI supported with Swiss TPH like 2 countries to do like some modeling to inform like costing. It was done in Colombia as well as in Haiti. They were like slightly like different like purposes. In Colombia, it was done at a subnational level to be able like to know what is the feasibility of malaria elimination and to understand like the different like costs associated to it. It was done last year with a lot of like partners. I mean, I cited like the malaria program, but there were like people in the ground. There were also like Swiss TPH doing like the modeling, PAHO as well, who helped define like the scenarios, as well as the IDB, who was like a potential donor. In Haiti, close, but not exactly like the same question, because here there was like a strategy for elimination, and the question would be like, what was the spatial package of intervention to be able like to reach that elimination in a phased approach, which was done like recently, actually. Again, I think with like a lot of like partners, it's mainly like the Maya program in the ground, like the modeler, and also like a set of like technical advisors as well as like potential donors. To present a little bit more details about Colombia, I mean, Colombia, like the model was used, so at the subnational level. Initially, it was like to evaluate the package of intervention that would lead to malaria elimination. Once that package was presented, then the plan was like costed, considering like different like operational constraints, and then that costed plan was eventually like used to generate like resource mobilization. So how does that look like? Well, you have like different like steps. Obviously, initially you work with existing data. So here, for example, we work with the incidence data which were like available, and then you will have to make like some assumption. So here, taking an example of the assumption in terms of intervention. So if you think about like what type of LLIN could be distributed or IRS, what would be like the timing to implement IRS or LLIN, and the frequency attached to it as well. Then based on those interventions, you come up with a couple of, you come up with a couple of scenarios. So here in Colombia, there were like 3 scenarios, one in 2040, one in 2032 for elimination, 2030, and one in 2022. Each of those scenarios and target date for elimination had different like aggressive intervention. The most aggressive was for a time frame of like 2022. 2040 was with increased case management and LLIN. So working with like Swiss TPH, like the different steps now were first like to estimate like the baseline, what was like the intrinsic risk of malaria in that region in Colombia. Then there were like different like scenarios that were simulated, and here like the outcome that you can see in front of you is actually for each of those like 3 time frame, what was like the mix of interventions that would lead like to elimination. This is a technical output, it's an epidemiological output, so then it was like translated into cost. Here an example of like what would be like the cost every year for LLIN. So that approach was taken in a, I would say like similar way in Haiti. Again, the question was a bit different in Haiti. So when you look at the map, like the different color, there are like the strategy which was decided by the program about how to get to elimination in a phased approach. So some of the commune in Haiti were to have elimination by 2020, some in green by 2022, and in blue by 2025. Then the question was like basically what are the interventions that you would need to implement to get there by that time. So again, the first step in it was really like to be able to determine what is like the baseline transmission risk in the country. So for this, like working with existing data or model data, so thinking about like the incidence of malaria in the country, where you can see on the map in the red place, which is 2 regions in the southwest of the country where most malaria is like focalized. Thinking about like the access to treatment as well, and obviously to have like the transmission potential or the like intrinsic risk, you would want like to understand what was the impact of interventions that were implemented. So in that case, LLIN. So once you have like your baseline map, then you can like simulate different like strategies. So multiple like scenarios were simulated for like a mix of intervention, community health worker, MDA, IRS, LLIN as well. Then eventually, like based on those like simulation for each pixel of the country, it was decided what intervention would lead to malaria elimination. Then there were like a few operational constraints about like where you can do some of those interventions. IRS that might not be like feasible everywhere, for example. And then the resulting like product was an operational stratification of the country about like what intervention should be done where. Again, I mean, you can see like the orange and red pixels on the map represent like places where the most aggressive intervention were suggested. If we would like stop here, that wouldn't really help for resource mobilization. I mean, it might look pretty, but you need to transform that into like some like costing figure. And so one of the example here with like the community health worker is that for each intervention, you need to think about like what are the activities attached to that intervention. So if you want to reach a specific level of like coverage by community health worker, what does that mean in terms of like the number of community health worker? what does that mean in terms of like the salary for the community health worker, what does that mean in terms of the training of the community health worker, of the supervision. So you want to list like all your activities which are associated with an intervention, and that like was costed in Haiti. And that was done for the different interventions that were suggested on the previous map. So a couple of like lessons briefly like summarized here from like this project. I think what we saw about like what worked well and repeating what has been said actually like in previous session, but definitely, I mean, early engagement with like partners, the malaria program, but also like the potential donor is definitely key. And then it's really like a one-off project where you come and you leave. It's actually like a very like iterative process where you need like people on the ground. I think being able to very clearly determine like the use case beforehand, engaging with program with like donors, to be able to know, well, is your objective to do like a fundraising for malaria? Is your objective to actually like know how like to cost or prioritize like operational plan? That is important because the methods that you might be using will be different based on your objective. Challenges that I think everyone has encountered like doing modeling is like usually like timeline are like pretty short, and especially because you need like to then do this iterative like process. And then also like when you think about it, I mean like modeling is only like a part of like resource mobilization. So there is kind of like a short timelines for modeling while they need like a broader and longer like long-term engagement with a different partner. And then I mean it's an opportunity, so it's not only about finding more resources, but it's also like actually providing a platform when you do like modeling to discuss and translate like the different like technical outputs. So it really like does like trigger a lot of like interesting discussion during the process. Obviously nothing is perfect. There are like a lot of like limitation to modeling. I think it's been mentioned before, but like poor quality of data or sometimes like unknown effectiveness of intervention will challenge like the outcome. You also like need to make sometimes like a lot of assumptions. So how like a lot is like too many or not is always like an important like question. In that case, we based more of the analysis on the epidemiological impact, but there could be like other approaches which are like more about like the cost effectiveness of the intervention and not only about like the technical aspect of it. And then like for the model like to be used, I mean, it means like capacity building across like in the country, outside of the country, I think among like all the different like partner. And also like remembering like modeling, it's not like an exact science, it's really like another like information added like to the pile of evidence among many others, whether they're like expert opinion, looking at actually like the collected and reported data. So, I mean, again, I think it's important to remember like how modeling can be used like for resource mobilization as like one tool among other. What we found like really if there is like one key to success for like the model to be used was having in-country presence, modeling like done by the program if like possible, or like by partner, which will pay like a significant amount of time in country, come once, come twice, come like 10 times if necessary to really make sure like everyone understands like the use of the model. But then like the foundation of all this, which I haven't really like mentioned before, it's like making sure that actually if you want to have something which is sustainable, it's not only about like having a model who's gonna like tell you, well, I need like $10 million, but it's like making sure that beyond that model, you build like a sustainable system through like a very good like surveillance system, a good like healthcare, and that's really like the underlying a bit like requirement of everything for this type of work to be effective. So on that note, I'm gonna stop here, but wanted like to thank the audience and also well all the partners really like Haiti and Colombia and MCP with whom like we work like very closely, and Swiss ASTMH who's done like most of the modeling. Thank you very much, everyone.